Thank you for taking time out of your busy schedule to view this presentation on mental health first aid. We believe that the adoption of these core competencies into practice will improve the outcomes for children with behavioral health needs and their families. These foundational modules are developed to be viewed by family members, higher education students, paraprofessionals, and professionals. A list of resources and references have also been provided. This module will be presented by Thomas Grinley from the Office of Consumer and Family Affairs at the Bureau of Behavioral Health. The New Hampshire Children's Behavioral Health Workforce Development Network is to build a sustainable infrastructure for the professional development of the children's behavioral health workforce based upon the core competencies and infused with the system of care core values and guiding principles. The need is for New Hampshire to have an adequate workforce and an infrastructure to support those who work with children, youth, and families. The New Hampshire Children's Behavioral Health Core Competencies were developed in 2011 by a representation of diverse stakeholder groups, including child-serving community mental health providers, family organizations, state policymakers, and university staff. The goal was that the competencies would be the first step in developing systematic and comprehensive human services development infrastructure. The competencies were developed using the system of care core values and principles as the foundation. There are 7 domains: family-driven and youth-guided practice, cultural and linguistic competence, childhood development and disorders, screening, assessment and referral, treatment planning, interventions and service delivery, systems knowledge and collaboration, and quality improvement. The competencies are organized for professional staff by levels of knowledge and skills in each domain. There are 3 levels: foundational, intermediary, and advanced. The levels are designed to identify the skill level of practitioners. They are fluid and not specifically tied to certain formal education and training or position titles. A copy of the report can be accessed, and a link is provided at the end of this presentation. This is one of a series of modules designed to support the development of core competencies in the children's behavioral health workforce. This overview of mental health first aid provides a summary of the mental health first aid training modules with a focus on the specialized training for youth. Mental health first aid is the help offered to a person developing a mental health problem or experiencing a mental health crisis. Youth mental health first aid teaches adults how to help adolescents ages 12 to 18 who are experiencing mental health or substance use issues. In some school districts, youth aged between 16 and 18 receive the training to be able to help their peers in times of crisis.
My name is Tom Grinley, and I am the Program Planner for the Office of Consumer and Family Affairs at the Bureau of Behavioral Health. I am also a mental health first aid instructor and a member of the Disaster Behavioral Health Response Team. This is a quick summary of mental health first aid with the focus on mental health first aid for youth. Mental health first aid is the help offered to a person developing a mental health problem or experiencing a mental health crisis. Like CPR, it is given until appropriate treatment and support are received, or until the crisis resolves. It is not a substitute for counseling, medical care, peer support, or other professional treatment. Mental health first aid is managed nationally through a partnership between the National Council for Behavioral Health as well as Maryland and Missouri state governments. Youth mental health first aid teaches adults how to help adolescents aged 12 to 18 who are experiencing mental health or substance use issues. In some school districts, youth aged between 16 and 18 receive the training to be able to help their peers in times of crisis. Participants learn risk factors and warning signs and a 5-step action plan for offering assistance. It will also provide information on different types of mental health issues and crises, and will cover available evidence-based professional, peer, and self-help resources. You will learn startling statistics on the prevalence of mental health issues, particularly among youth. You will also learn the signs and symptoms of depression and how to deal with various mental health crises. Like first aid, which has its ABC mnemonic for airway, breathing, and circulation, mental health first aid has its own mnemonic, ALGE. Assess for risk of suicide or harm. Listen non-judgmentally. Give reassurance and information. Encourage appropriate professional help. Encourage self-help and other support strategies. The plan does not necessarily have to be done in this order. This mnemonic is also the name of the mental health first aid mascot, Algie the koala. This is Algie. The choice of a koala reflects the Australian origins of mental health first aid. So what is mental illness? Mental illness is a diagnosable illness that affects a person's thinking, emotional state, and behavior. It can disrupt a person's ability to work or participate in school, carry out daily activities, or engage in satisfying relationships. Half of all mental illness has an onset prior to age 14, and fully 3/4 by age 24. Mental health issues can be difficult to spot in youth because of all the other adolescent issues they are struggling with, but it is when most serious mental illnesses first manifest themselves. We now know that early intervention at the first signs of mental illness is crucial to improving long-term outcomes. Some of the most recent numbers released just a few months ago. 10.7% of adolescents had a major depressive episode in 2013. 7.7% had an episode of severe depression with severe impairment affecting their ability to engage in daily activities. That's 2.6 million youth with major depressive disorder, 1.9 million of which are severely impaired by their depression. In other words, nearly 3/4 of adolescents with major depression have a severe impairment. According to the World Health Organization, worldwide, suicide was the third leading cause of death among adolescents. For the population as a whole, it is the 10th leading cause of death. However, a study released just a few months ago has moved suicide amongst adolescents to the second leading cause of death. When we look at the top 10 causes of disability among adolescents, depression is way out front in the number one spot. Remember, we said that nearly 3/4 of adolescents with major depression were severely impaired by it. Anxiety disorders are at number 8, and self-harm, often a sign of an underlying emotional disorder, is at number 5. Suicide among youth is also a growing concern. 4,600 youth per year are lost to suicide. A nationwide survey of youth in grade 9 through 12 in public and private school in the United States found that 16% of students reported seriously considering suicide. 13% reported creating a plan, and 8% reported trying to take their own life in the 12 months preceding the survey. Each year, approximately 157,000 youth between the ages of 10 and 24 receive medical care for self-inflicted injuries at emergency departments across the U.S. Overall, 9.3 million people had serious thoughts of suicide in 2013. Just over 1 million contacted the suicide hotline. If we can increase that number, we can decrease the number of attempted suicides. Sometimes people do want to talk about it. This is the National Suicide Hotline, 1-800-273-TALK. In 2013, they hit 1 million calls per year. Memorize this number. It could save a life, perhaps even your own. So where does mental health first aid fit in the continuum of services for mental health and substance use disorders? Mental health first aid is an early intervention when the individual first starts to become unwell. Note that recovery requires professional treatment. That is one of the steps of mental health first aid. Encourage appropriate professional help. Ideally, prevention efforts will avoid the need for an intervention, but we should be prepared for when they don't. Asking why mental health first aid is akin to asking why first aid. Quite simply, professional help is not always immediately available. Knowing how to recognize and deal with mental health issues also helps to decrease the stigma associated with mental illness. Also, as we have seen, mental health issues are quite common. It is estimated that nearly 1 in 5 people will experience a mental health issue in any given year. In some populations, this is even higher. Among homeless youth, for example, the incidence of mental health issues increases to 1 out of 4. As of December 2014, 6,300 instructors had trained 310,000 people in mental health first aid. Those numbers are growing exponentially with support from both the U.S. Congress and state legislatures to provide funds for more training. The New Hampshire Department of Education, for example, has a grant to provide mental health first aid training to teachers, athletic coaches, playground attendants, and others who can detect and respond to mental health issues in youth. 6,300 instructors required to deliver 3 trainings per year to maintain certification could double that number this year alone. This course is appropriate for anyone aged 16 and older who wants to learn more about mental illness. The majority of courses, 31%, are taught to a general community audience. Only 4.5% of training attendees work with youth focus group. We must work to dramatically increase that number. Brief background. The program was developed in Australia in 2001. It was adapted for and managed in the U.S. by the National Council for Behavioral Health, the Maryland Department of Mental Hygiene, and the Missouri Department of Mental Health. Mental health is listed in SAMHSA's National Registry of Evidence-Based Programs and Practices. Published peer-reviewed studies about the course show that people who get trained in mental health first aid, it increases knowledge and understanding, encourages people helping people, supports people getting help, decreases social distance, and increases mental wellness. The rapid growth of mental health first aid is both reflected and promoted by a lot of recent press coverage. The positive press has led to more people becoming trained in mental health first aid. Some of the news stories demonstrate the many ways that mental health first aid can be deployed. New York University, for example, trains staff that works in high-stress locations on campus. I urge everyone to attend a mental health first aid training and especially encourage those that work with youth to do so. It may be the most important skill you add to your repertoire of training. For courses aimed specifically at helping youth, check for the purple youth icon on course details and instructor profiles. To find a course or instructor near you, check out www.mentalhealthfirstaid.org. For more information, email info@mentalhealthfirstaid.org or call 202-684-7457. Take a course. You could be the help someone needs.